Hi everyone, Keith Marsden here, Landscape's Health and Safety Manager. It's great to hear all the positive feedback that we've been receiving about Landscape's operatives, going the extra mile and continuing to deliver the vital frontline services which do make a difference to people's lives. I fully appreciate how difficult it must be to go out to work at the moment, and especially after listening to some of the stories on the news and realising the serious impact that this virus is having on people. Over the past couple of weeks, I've received quite a number of queries in relation to the wearing of personal protective equipment, and in particular, which PPE should be provided and should be worn to protect against COVID-19 for both our internal operatives carrying out cleaning duties and also external operatives carrying out the general maintenance landscapes. What I'd like to do today is just take this opportunity to clarify a few points around PPE and explain some of the decisions which have been made up to now. Firstly, when we look at the controls for any risk, whether it be exposure to coronavirus, the use of equipment or chemicals, or anything that may cause us harm or ill health, it's important to remember that there is a hierarchy of control measures that must be followed, and PPE is always going to be the last line of defence. In some instances, if PPE is not used correctly, or it's not fully understood what level of protection will be provided, then this could end up putting an individual at an even greater risk. The most important thing to remember is that of the primary and most effective controls in place, which are to follow the government guidelines, i.e. carrying out social distancing, therefore always trying to maintain a 2 metre distance between yourselves and others. You can achieve this also by introducing barrier tape, cones, signage to deter members of the public from approaching you. Remember, if you cannot achieve social distancing whilst on site, then you should walk away and record this on an Intex audit. Good personal hygiene. This is vital. Make sure that you wash your hands very regularly, either using soap and water or, where available, alcohol gel. This should be carried out as often as you possibly can and always after touching contact surfaces or shared equipment. If you require any materials to carry this out, then you must speak with your line manager. At the same time, it's important that you avoid touching your face and do not smoke or eat without adequately washing your hands, because if your hands do become contaminated from contact with surfaces, for example, then this could lead to the virus being transferred into your body through your mouth, eyes and nose. When it comes to personal protective equipment in relation to COVID-19, there are 4 main types of PPE which are often talked about and associated with the virus: disposable gloves, disposable suits or protective clothing, eye protection and face masks, each of which I'm just going to say a little bit about individually. Disposable gloves. So within landscapes, we've provided disposable gloves to operatives which should be used by those carrying out cleaning activities, as they will protect against the cleaning products being used. They are also for operatives to wear to prevent their hands from becoming contaminated. However, it's important that gloves are always taken off correctly and carefully in order to avoid any cross-contamination. You should always avoid touching the outer surface of the glove. And following the removal of gloves, you still need to be washing your hands. The virus cannot be absorbed into your skin, so therefore, unless you've got any cuts or any broken skin, it is safe to handle things without gloves on, again, as long as you're washing your hands frequently. Protective clothing, such as disposable suits or aprons, are predominantly provided to those people who are at work and at risk of becoming contaminated from splashes or bodily fluids, which may contain the virus. Therefore, these have not been provided to staff at this stage. That said, if you've got any concerns with your clothing becoming contaminated, then you must speak with your line manager or contact myself, and we can risk assess the individual situation to ensure that you are adequately protected. I would recommend that those carrying out cleaning activities roll up your sleeves. This will reduce the risk of contamination on your clothing, and then again wash your hands thoroughly and wash your arms as well thoroughly, just as you would do with your hands following any work activities. Eye protection is required for when you are handling chemicals where there's a risk of splashes due to mixing or using them. However, in the context of coronavirus, eye protection is only required where there's a risk of bodily fluids splashing into someone's face through close contact with a symptomatic or ill person, or whilst you're cleaning heavily contaminated environments. Now, lastly, face masks. These are perhaps the most talked about piece of PPE in relation to coronavirus, and there are varying opinions from scientists around the world as to the benefit and the reasons for wearing or not wearing them. The World Health Organization and Public Health England advises that masks only need to be worn by those who are caring for, and therefore those people who are exposed to symptomatic or confirmed cases of COVID-19, or by people who themselves are infected and are ill, to prevent them from passing the virus on to others. The masks work by preventing water droplets from an infected or potentially infected person entering into someone else's mouth, so being ejected, and also they prevent them being spread into the atmosphere. Masks may be supplied in landscapes in some scenarios in the future. For example, if operatives are required to carry out any deep cleaning in a highly contaminated area. However, this is not currently the case, and therefore they are not currently necessary for the general duties that you are carrying out. Studies are being carried out as I speak to determine the effectiveness of masks and the type of mask which should be worn. However, the decision by landscapes not to have a blanket approach to issue face masks to staff is based on the latest guidance available, the type of work being carried out, and also the other controls that we have introduced. The other factors we've had to consider about masks and all PPE is if we do issue lots of PPE unnecessarily, that can, in some cases, make people become complacent, almost feel like they're bulletproof once they've got the PPE on, and we don't want to do this as this would increase the risk. As with gloves, it's important that with any masks, you ensure that they are taken off correctly as well, and the risk is significantly higher if people are unaware how to do this correctly. If you are required to wear a mask, then the appropriate training will be provided. But as I reiterate, masks can cause more of a risk to people, and they also do encourage a person to touch the face more frequently, as you'll be constantly adjusting it whilst you're working. Other factors would be that there's a mental impact on staff and tenants if PPE is unnecessarily issued. This could be that people's perception of the risk is much higher, and that creates anxiety. And we don't want that to be the case at the moment. We also recognise there's a national shortage of PPE across the country and internationally as well, to be honest. What we don't want to do is end up taking PPE away from the people that need it, those frontline health workers, where it's important that they rely on PPE as they have no option of social distancing and are working very closely with people who are ill. Hopefully, this helps you to have a better understanding of the current measures in place and some reassurance as to the thought that's gone into the decisions that's been made. However, if anyone has got any concerns or you feel unsafe at work, please speak with your line manager, or you can contact myself directly, and we will ensure that we carry out a risk assessment and provide you with everything that you need to do your job safely and to feel safe. I will continue to monitor all available guidance on PPE, and additional PPE may be issued in the future as further information becomes available, but this, like I say, will be determined by the risk assessment of the activities being carried out and any changes in government guidance, PHE guidance, the World Health Organization guidance. Remember, If you're asked to do anything that you feel is risk or you're not comfortable with, so for example, if you go to an environment where you're due to clean and there are people sat in a communal area, then you must walk away and contact your line manager, because, as I said, the most important controls we have in place are social distancing and good personal hygiene practices. Thanks for listening, everyone, and stay safe.